Problems with ambulance offload wait times, response times to 911 calls, and paramedic staffing levels have been well documented in Nova Scotia for years. Today, the province's Auditor General highlighted these issues in her most recent report. And as she points out, Nova Scotia's ground ambulance system finds itself in what she calls a critical state. In many ways, the issues are symptomatic of larger problems within the healthcare system. If someone in a hospital bed is waiting for a long-term care space, it means fewer spaces for people in emergency departments awaiting hospital beds. And if emergency departments are clogged, it means paramedics waiting longer with their patients to transfer them to hospital staff and then get back on the road. The longer they're waiting to get back on the road, the greater the effect on 911 call response times. Auditor General Kim Adair has 4 reasons that contribute to this problem. She points to offload delays at emergency departments, paramedic staffing challenges, an increase in the volume of 911 calls, and more closures at rural emergency departments. Adair acknowledges the healthcare system is complex.
It's hard to look at one component of the system and only focus on that, which is what we were doing here at Ground Ambulance Services. There's a myriad of issues and pressures impacting response times, and there's so many interconnected parts.
But she says there needs to be more accountability for dealing with offload delays and the ongoing challenges that paramedics face. Those challenges are driving people from the profession sooner, and last year resulted in the inability to staff 23% of daily scheduled ambulances. The health minister says she's part of a group that's come together to try to improve the situation.
There is, for the first time, a table that has Nova Scotia Health, Department of Health, the Paramedics Union, as well as the college, and we sit as a group and problem solve some of the things that really are very difficult for paramedics in the field.
Thompson says this has resulted in changes to improve the workplace and working conditions for paramedics. She says there's also an effort to open contract talks sooner before the agreement expires to address long-standing concerns paramedics have expressed about their wages. Although Adair's report today notes that paramedic wages in Nova Scotia are in line with the rest of Atlantic Canada, union representatives have expressed concerns for years that paramedics who train here often leave for other parts of Canada where they can make more money. Michael Gorman, CBC News, Halifax.